reality is, for the next 6 to 18 months, we are going to see multiple waves of this actually take place, and local restrictions on mobility are going to vary whether that country or that location is actually escalating, de-escalating on that wave curve, or re-escalating. Another example of this is Hong Kong, Singapore, and Taiwan, for example. We escalated, I'm based in Singapore right now, we escalated very early. We were able to initially bring the case volume down. And then once again, we relaxed our measures. And then once again, we saw the case volume rise, and the restrictions on domestic mobility have progressively become more stringent. So you'll see those restrictions change based on the pandemic wave. But outside of that medical component, and again, I think this is critical for understanding how and when you can resume travel, is the fact that it is additional, very local context which may affect the ability to maintain those restrictions. One is clearly the administrative structure within countries. What we're seeing is that different tiers of government have different authority to be able to actually impose restrictions. And perfect example of this is Indonesia, where there's no uniform federally imposed restrictions on domestic restrictions. Instead, the restrictions are being placed by different cities, different regencies, different districts, and they vary from place to place, which makes it a lot more complicated for somebody who is looking to travel to Indonesia to understand what those challenges may actually be when they get there. The other is the legal framework to actually keep and maintain those restrictions. Certain organizations, certain countries don't actually have the legal framework to impose emergency restrictions, and they've actually had to enact emergency powers at the last minute to allow them to do so. How long and what the duration of those restrictions are will depend on the specific granting of legal power to the authorities to be able to do so. Similarly is the cultural norms associated with restrictions on mobility. In countries like Malaysia, Taiwan, Singapore, and Japan, actually you don't see the authorities necessarily having to impose very high penalties associated with these restrictions, partly because these countries, you have a culture in which the society generally adopts what the authorities are saying. But at the other end of the spectrum, you have countries in which they're actually, the society is quite uncomfortable with these restrictions, and there's significant pressure from the populace to limit the restrictions, as they're seen as a violation of an individual's privacy rights or individual rights. The other concern is obviously around the sensitivity to economic and political fallout from such restrictions. So I think the concerns over the economic impact of these restrictions and the associated negative impact on the markets is going to influence how the authorities react to this. And you can see this with countries like Indonesia and Thailand, who were actually quite slow initially to enhance their restrictions, partly because of fear of the economic conditions that would result from that. And I think the countries that are currently in an election cycle, for example, the United States, those are the most vulnerable to this type of sensitivity associated with maintaining domestic restrictions. All right, can we actually go to the next slide? All right, so I do want to, that was a very brief or maybe not so brief discussion on the restrictions associated with logistics, and that's going to continue to pose a significant challenge to organizations who operate within their home country like Malaysia, but who are also looking at how they can resume travel across the globe. The other factor I really wanted to focus in on was the second and third order security consequences that have resulted from the spread of COVID-19. And myself, I have seen a shift in terms of the client interest over the past 3 weeks or so, as well as there's a documentable change in the risk environment, especially in parts of Asia Pacific, that show that we are already beginning to see these security consequences of the spread of COVID-19. Now, I think the most eminent of these, and potentially the ones that have the most significant consequences for individuals on this webinar today, is the rise in xenophobia. And that xenophobia is targeting individuals coming from or perceived to be coming from quote unquote hotspots of COVID-19, of the COVID-19 outbreak. And what those hotspots are, or how the perception of those hotspots really depends on what the public discourse in that country specifically is. So if we look at countries in Western Europe or in the United States, for example, in the Western Hemisphere, we see a narrative that is that the COVID-19 originates from East Asia, and it's East Asians who have brought it to this environment, and as a result, you see certain forms of xenophobia taking place against East Asian nationals or people perceived to be from East Asia. At the same time, here in APAC, the narrative is quite different. The narrative is that actually this was imported via Western Europeans, and you're seeing in places like India, Myanmar, Thailand, Indonesia, and the Philippines, where Western nationals have been singled out for acts of xenophobia. Now, what does the xenophobia actually look like? I think it really depends, again, on which country you are, but in the majority of cases, that xenophobia is usually low-level verbal harassment, as well as potentially refusal to serve these individuals at local businesses. So at hotels, at restaurants, they won't be served because they're believed to actually have imported the COVID-19 disease into that environment. In some more severe cases, we've seen landlords actually expel their tenants, their expatriate tenants, for this very reason. And then in the most rarest of circumstances, but it still does happen, we've seen actual physical violence. So individuals actually being beaten up because of their nationality or their perceived nationality or ethnic background. So that's xenophobia. That's of immediate consequence. The next one I wanted to talk about is actually some of the more medium to longer term consequences, and I've already begun to see a rise in these incidents taking place, but it's issues associated with political violence, issues associated with social unrest, violent as well as petty crime. Are some of the growing concerns in the region. And the longer these restrictions on domestic mobility exist, the longer we feel the economic impact of COVID-19 in these locations, the more likely it is that we're going to see these incidents of violence or security incidents actually begin to escalate. And while no country in Asia Pacific is actually exempt from these security incidents, I do want to highlight a couple of hotspots: India, Indonesia, and then followed by Philippines, Cambodia, and Thailand. So if we're looking at India, xenophobia is, again, a serious concern. And we've seen xenophobia probably at its highest rate in India compared to some of the other countries in the region. And in India, India has a history of vigilantism exacerbated by fake news that spread on social media. And over the course of the past month or so, I've seen a rapid increase in the amount of fake news associated with COVID-19, and fake news that specifically fans that discourse that COVID-19 is actually imported from Western Europe as well as from East Asia. And so we have seen some of those xenophobic incidents take place that I had highlighted earlier. Now, in addition to that is the fact that India has a very large informal economy. And the lockdown, which was initially imposed for 21 days and now has been extended, is obviously going to have a disproportionate effect on that people who work in that in that informal economy. Now, within that informal economy are the domestic migrant workers who are now largely unemployed, who don't have access to essential supplies like food and water, and they can't return back home because of the mandatory lockdown that's actually in place. So the longer that this remains in place, the more likely it is that we're going to see a spike in social unrest in India. The other country, Indonesia. Now, Indonesia has a history of large-scale political instability when economic conditions actually sour. And most recently, the finance minister indicated that the projected growth in Indonesia, and this is probably a little bit optimistic, could slip to zero. And the last time we saw such conditions was in the 1960s when Sukarno was removed by the military, and then again in 1998 when we saw Suharto, who was removed following mass rioting, and mass rioting specifically focused on ethnic Chinese Indonesians. Now, do I believe that the same thing is actually going to happen this time around? Definitely no. I don't think that's the case. I think Indonesia's institutions are far more robust now than they were 20 years ago. Democracy is far more robust than it was. But at the same time, the longer these restrictions remain in place, the more or the stronger the likelihood of significant bouts of unrest. Now, what are we watching out for in international SOS as a sign of a deteriorating security environment? It's really about watching how the religious authorities react to the ban on religious congregations during Ramadan, which will start towards the end of April. Do the religious authorities support this ban, or do the religious authorities actually use this as a talking point against President Jokowi, who's already on a back foot with the certain segments of this establishment? Now, if we were to take what's actually happened in Indonesia so far they've been very supportive of this ban. But if you look at other countries like Pakistan, India, and Bangladesh, you're seeing religious authorities saying that they would flout these measures during the month of Ramadan. So that's one thing that we really need to watch closely if the same thing is replicated in Indonesia. The other one is that when we do see economic downturns in Indonesia, we also see an associated rise in ethnic tensions. So we need to see and watch that dialogue of how these ethnic tensions play out as the economic conditions continue to deteriorate. And then, of course, countries that already have pre-existing higher rates of crime, Philippines, Cambodia, and Thailand, we've already begun to see a rise in official statistics, which are indicating that petty and opportunistic crime, as well as some minor incidents of looting, have begun to be reported. All right, with that, can we actually move to the next slide? Okay, so what are some of the best practices associated with managing these security or logistical related challenges that organizations face when making the decision to resume travel? So for the time being, we still continue to say that you should continue to defer all non-essential travel, and all essential travel needs to be approved on a case-by-case basis. But as I mentioned earlier, we're really operating on a pandemic wave curve, and we'll see multiple waves of this continue for the next 6 to 18 months. And this very robust advice around deferring non-essential travel cannot be maintained indefinitely. It's not sustainable for you as risk managers to implement such measures, given the reality that organizations need to restart their business as well. So as we see this de-escalate, I would actually say we're operating in what's going to be for the foreseeable future a new normal in which COVID-19 remains an ever-present threat while you're still traveling. So your return to work and your return to travel policies need to reflect this new reality and need to be doing the appropriate due diligence so that you can remain safe and secure while you're traveling, but at the same time, you're enabling your business to continue. Now, if you're in a higher risk location, some of the places that I spoke of before, you really need to make sure that you are doing your due diligence around scenario planning. So looking at how the security environment may potentially evolve and how that security environment may potentially specifically affect you. And one of the key ways to do this, or one of the best practices in doing this, is making sure that you have early indicators of a deteriorating security environment. The worst thing that you can have happen at this point is that you react to a security incident too late. And given the operational constraints that we are operating under right now, in the fact that international mobility, domestic mobility is very restricted, responding will be quite a significant challenge. So having those early indicators to show you which direction the security environment is actually headed in, and so that you can proactively take the appropriate risk mitigating measures, whether that is weathering the storm in place, or whether that is proactively minimizing your exposure to the incident. It's critical that you have those early indicators. And the second component is having a very robust action plan. So I think it's the days are gone when we could say, hey, when the storm actually hits or when something bad really happens, I'm just going to get my individuals out via commercial aviation. That's not a realistic option at this point. So making sure you have multiple contingency plans that look at what your evacuation options really are is absolutely critical. And one key component of that is really determining what are the capability of your local logistics and security providers to be able to provide assistance on the ground. And I will be honest that most logistics and security providers at this point are operating under certain operational constraints, and therefore you need to understand what those constraints are and how you can actually augment or fill the gaps to be able to minimize the effects of those constraints. And then the last component that I'd like to highlight is that even when organizations or your providers are actually on the ground to be able to provide you with support, there's always going to be a period in which you need to stand fast. And from that perspective, having robust stand fast planning, making sure that you have access to essential supplies, making sure that you've determined what your secure accommodation where you'll hunker down until help can actually arrive is absolutely critical. All right, so that is the logistics and security component. And with that, I'd like to hand it back over to the administrator for the question and answer period.
Thank you, Aditya and Dr. Chan, for earlier presentations. We will now take some questions from our attendees, and we have a lot of them. So thank you for asking your questions. Some of them are overlapping, so we'll try to combine them and address all these concerns. Perhaps the most overarching question is, how long do you expect the COVID-19 outbreak to last? And we can combine this with questions from HLAP, Mr. Shukri, and even Jennifer Lopez, BMCC ED, about the peak in Malaysia. How long do you think the MCO will last or should last? So perhaps Mr. Aditya can address this. How long do you think the COVID-19 outbreak is expected to last?
Actually, so I mean, I think Dr. Chan should be able to address that from a medical perspective, and that then I can add on from what my view is for the longer term medical, the security and logistical consequences of this.
Thanks, Aaron. Thanks, Aditya. So for Malaysia, the past 4 weeks of movement control order, it has definitely done us a lot of good. Because we are seeing new cases at about 100, 120 plus to slightly shy of 200 new cases per day. It is pretty steady. Our recovery rate is getting more and more encouraging. We are almost approaching 50% of recovery rate. Very minute percentage of people are actually using a ventilator to assist the breathing. All these are good news. However, we are seeing the major clusters being fanning out into at least fifth generation of people getting infected. There are still a lot of people not being detected yet. We need to take this current fifth and sixth week of movement control order in highest degree of caution. We need to test more, isolate those who are sick. Hopefully they are getting well sooner, so that we do not test the ultimate capability of our healthcare. Because if we are going at this rate, probably all the beds would be used up. Realistically speaking, we can only see some good resolution, or at least some sizable good exit strategy of all this movement control, internally or even internationally, say in no less than till December. That's the earliest date that we have heard from the medical fraternity that a reliable vaccine will be arriving. So in short, if there's no vaccine, then there's no clear end to the pandemic. Yeah.
Thank you, Dr. Chan. Aditya, would you like to add anything?
Yeah, sorry. Absolutely. So in addition to what Dr. Chan said, I think, you know, even once we see the multiple waves of the pandemic passing through, the longer term consequences of this are going to remain for a foreseeable future. It's not easy. We're looking at what technically amounts to one of the worst economic crises the globe has seen since the Great Depression in the 1930s. And based on that, you're going to see some of the security incidents that I talked about, social unrest, crime, terrorism, political instability continue for years to come.
Right. Thank you, Aditya. We have another question here, perhaps covering the areas of education and even domestic and national security. For families and students that are planning to travel back to their home countries, do you think they should stay or go home? What are the considerations?
Yeah, I'm assuming that's directed to me. I think that's a really good question, and it's interesting because our response has actually begun to shift as well. Initially, it was very much you do want to get to your home country as soon as possible because you have the emotional support, you have your family, you have additional familiarity that will actually be able to aid or help you ride out this crisis. I think it's become a lot more complex now, right? You need to be able to assess what the risks are in location, how comfortable your individual actually is staying based on those risks, and how risky is it to return to your home country as well. Case data is obviously one. What's the outbreak like in those locations? What's the ability of the local medical health infrastructure to be able to cope with those restrictions? But it's also the security concerns that I outlined. You know, what is the potential medium to long-term security implications of COVID-19 in both the country of origin and in the country that you actually want to travel to? So I would really say it is based on doing a bespoke risk assessment on the origin and destination, as well as determining what the comfort level of the individual is once they have all of those facts.
Thank you, Aditya. Dr. Chan, perhaps you'd like to take this one from David Manifold. The difference in the numbers of both confirmed cases and deaths in Southeast Asia, on the one hand, and Europe and North America on the other, is striking. What are the possible reasons for this?
Thanks, Aaron. So for Southeast Asia, it is not all the 11 countries, including Timor-Leste, which is not in ASEAN, that has that have demonstrated the maximal possible testing capabilities. It can be due to the public health strategy, the affordability of the local country in procuring test kit, and of course the number of individuals living in that country. For example, between Malaysia and Indonesia, the population is really a big difference. Yeah, so we are sure that the European countries and also America, they're actually really actively testing, whereas we have seen in Indonesia and in Philippines, although the cases are now in a larger amount, or rather total number of confirmed cases compared to Malaysia in the past 24 hours, but they are not testing as much, so they are actually missing out the possibly unwell people who are actually suffering from COVID-19 cases. So whatever we are seeing now in Southeast Asia is not yet the true color of COVID-19 is hitting the region per se. We have heard some argument about is it a cold country thing or is it a tropical climate? No clear facts on that. It is actually based on how robustly we are testing it. And about the virus strains, we do know for sure there are 2 strains now. Is Malaysia having the milder form of COVID-19 virus? We will know soon because ongoing study is taking place. It is a good thing. Malaysia is not seeing as much deaths or not as many people being on mechanical ventilators. But just in case, we still do not know this virus very well. And we need more collaborative information from various continents. I believe it's already happening at the level of WHO, and we will know in the weeks or even the months to come. So our level of alertness must still remain high as long as we are in Southeast Asia, because we may not know how virulent it will be at the end of the day. Yeah.
Thanks, Dr. Chan. On that note, actually, a question from Mr. David Ng, directed to you. When MCO is lifted and employees go back to work, do you think it is advisable for companies to use rapid test kits?
Thanks, Aaron. If we look at the world today, including Malaysia and also Southeast Asia, millions of people are now either staying at home or working from home or on lockdown, whichever we would like to call it. If we divide the world population into 2, it's actually those who are caring for patients, mainly healthcare workers, and those who are not healthcare workers, right? We, as a world, we are actually facing a great deal of difficulty in even procuring things like surgical 3-ply masks, N95 masks, and proper protective gear while caring for a patient. So we are seeing even the healthcare workers getting infected. Now, rapid test kit is good because it doesn't need the healthcare worker, the nurse or the doctor to use a swab to ask the patient to say swab the nose and swab the throat. Because COVID-19 virus is actually a respiratory virus. So when we do the swab, if we do not wear the right protective gear, that's when a healthcare worker can even get infected. We have seen this in many countries. So rapid test kit, there are various types being developed in countries like China, America, and also South Korea. Some are being said to be quite reliable, but as for Malaysia, we have tested a few, even including testing for the virus itself, and a few more brands testing for the antibody, but the false negative hood is high. Yeah. So The search for the ideal on-the-spot testing rapid test kit is still ongoing. Ministry of Health of Malaysia, including many Southeast Asian countries, still looking for it because it will save time. And yes, it is a tool that can be used when it is good enough to be used to assist those non-vulnerable group of individuals. For example, the healthier ones or the younger ones to go back to work and spur the economy again. I think that is the balance that various countries trying to take, not to tempt fate with the public health system, but at the same time trying to act based on science. Yeah.
Thank you, Dr. Chan. I think that's all the time we have for today's webinar. Thank you everyone for sending your questions and for joining us today. Again, thank you to our speakers, Dr. Chan and Mr. Aditya, for your time and insight. And of course to International SOS for making this possible. We hope to see everyone for our next webinar tomorrow. For more information and registrations, you can head over to our BMCC website. Thank you. Stay safe, stay well.
Thank you.
Thanks.